5 days. I think you have. There you go.
Right. You're starting this one.
I see the nursing home here. Might be a.
Yes, that's a clue.
That might be a clue.
Maybe they just wanted to.
I don't think they're just visiting. Yeah. 17. Okay.
They should be looking at notes to see what the questions were, or just read people on their questions. So I think my first question is, I believe you had a phone conversation about what first year might be this week.
We did, yes, yes. I think the initial projection as it's calculated is we will be looking to receive a payment of just over $1.9 million.
So close to what you had in your estimation, because I think we had 1.8 million.
Yeah, Frank's got some updated revenue information that he wants to share with you.
I think you had to propose anyway, I guess, if for your
Great.
consideration on it.
Why
So,
don't you start?
so on the revenue side, I think because that's the 1.9 million is what we're anticipated to receive in this current fiscal year. Because our census projection is essentially mirroring what we currently proposed for this year. I feel comfortable increasing what we've requested as 1.8 million, increasing that by 100,000 and bringing it to 1.9 million. The other thing that was discussed on the call with the department on Tuesday was, if you remember last year, there was a tremendous amount of concern in regards to the pro share calculation, and there was a concern specifically about a 60% threshold of charges to customary charges to cost per diem cost. And it puts several counties in kind of a danger zone. We weren't in that danger zone because we were below that 60% threshold, but we did discuss that on Tuesday's call, and we were informed that this is no longer going to be a concern going forward, that the state Medicaid director has I don't know exactly what, but has done something to ensure that there is no longer going to be a concern about that being under that threshold of customary charge. So with that being said, I think the other thing that we could propose to do this year is to increase our private pay rates by $15 a day. So in doing so with that would add another $120,000, so $128,450 in revenue. So
Could you repeat that, please? 128.
$120,450. So we would bring our private room rate to $370 per day. And we would bring our semi-private room rate to $350 per day.
320,000.
220,000.
220, sorry. That's why I'm a little aggressive.
So I think that, those are very safe assumptions, I think, to make at this point. And so I think I'm comfortable in doing.
So you're comfortable with doing that. That sounds good to me. I think the reason that
you were asked to come back is because of, some questions about how the figures were arrived at, if I'm remembering correctly, for the nursing, for the
Oh.
nursing.
So let's just ask, any other revenue related before we move on?
Not at this time. I think, you know, we won't know what our anticipated July 1 Medicaid rate is probably until the week of Memorial Day. So, you know, roughly this time next month, I think we'll have an idea of what our projected Medicaid payment is going to be. If you remember during the presentation, I was, you know, conservative on the reducing it down. So we'll find out what that potentially looks like for us for July 1st. So there might be some additional opportunity there, but I don't want to speculate on that.
And then,
So-
Commissioner Piper's question.
Yeah, so, it's the question that I wrote down, was there was some on the nursing line, the large wage increase. And so there was some question about how we're getting those numbers. And then that turned into a deeper discussion, about the methodology that, that is used generally, for staff for the nursing home.
So are we talking about 5140 the nursing?
5140, yeah.
Oh, yeah.
The LNAs was the one that had the huge increase.
It's 800,000. Yeah. 870.
So I have a little snippet of just kind of in general speaking to how to put it together. Thank you.
No, thank you. This is.
So that's, I mean, that's the process that we used when we put the lines together.
For just these three categories.
Yes, yeah.
So when you say you annualize the salary lines through February. What do you mean by that exactly?
So the payrolls that had been accumulated from July 1 up through the end of February.
Okay, so
we
the
take
9.
that and then just, and
By the way, seven mobile.
So it's a different methodology, at least this is what we heard from the county administrator. It's a different methodology in terms of staffing than other departments might use. Other departments might break out, you know, how many, like, you know, if I were a paid employee, what my salary is, and it's not broken out the way that other departments are, I guess, if I understand, but Julie's the one that can speak to that. Could you speak to that?
I think if we can give you a little more.
Yeah.
Specificity, was it mostly on the retirement line or on the? It was on a particular line that we. The question.
No, it's the LNA, LPN and RN salary line I listed that.
Okay, I thought there was a different method that was applied to everyone and that one was in that.
These are the only three lines we annualize. We separate everybody out on spreadsheets by their actual salary rate. Always use this methodology for these three lines. And I'm betting.
Yeah, and what's the reason for that? Because I think that that's what came under question the other day.
We've always looked at average payrolls per year.
As opposed to looking at, you have X number of LNA positions at X salary and figuring in a budget whether you fill those positions or not.
Correct. I've done it that way before and it always very inaccurate.
It's always what I'm saying.
Inaccurate, very too low.
Unfortunately. So it always comes in too low if you do it that way.
If I do it that way. and then we'd over expend.
That wouldn't be true if you were budgeting for all your vacancies in years where your positions weren't filled. You'd have more money in the budget then. If you budgeted for every position, every FTE, then you're gonna was allotted for these positions. Actuals for the people that we have and then estimated rates for the vacant positions, you wouldn't be under budget, you'd be over budget in the years where your staffing levels were lower. The problem with doing it this way is we're doing this. As the staffing levels drop. And you budget for the next year at these low levels, and then we come in, we get all this extra staff. Then we're way under budget this year, and then the next year we're budgeting way higher, and so we're basically doing this with the biggest salary line items within our budget. And we've always fallen back on the contract nursing line item. Well, this year, the contract nursing line item is gonna be overexpended as well as all three of those line items, so that math doesn't math to me, like, if we're increasing our staff, why are we over our contract nursing? That's what I'm struggling with understanding, and my lack of understanding of doing the budget that way. If your salary, I mean, if your staffing levels are flat, then that likely probably works. But where we've seen such varied fluctuation in the nursing staff, we dropped it to such low levels. We dropped the budget when we did that. And now, as we climbed with those levels, we're still always playing catch up. I don't know if that makes sense, but that's what where I'm struggling with. And then, like I said in my question yesterday, when you annualize the salary, if you're taking 8 months and dividing by the total, dividing by 8 and multiplying that by 4, that's already including your shift diffs and your overtime and all the other trainings and all that stuff. So I was just confused. Are you adding those back in, these breakdowns of these numbers that you gave me? You add that in on top of what the annualized salary is gonna be? Because that would already be included. So when you analyze it, you break out shift diff and overtime,
I just,
and you
Look,
only,
I looked at, I mean, I can give you this, I did it this morning. I looked at March, annualized through March 31st, came up with a number. There is a small difference in each line that gives us a cushion for next year. But not much.
So what are those numbers? So they're not labeled, so if you could read them to me with labels, so I know how to write them down, would be really helpful.
Their LNAs are annualizing at 5.481192 million. You see what I budgeted, 5,682,148. Leaves a difference of 200,955. So if you cut that out, there would be nothing left for any kind of cushion for next year. LPNs, 1.521,693,000. And RNs, 1.782,620,000. I shifted 50,000 down from the nursing admin line that's been running high with overtime. And shift diffs, so I moved that down and reduced the nursing admin line by 50,000 from what it is actually annualizing.
I'll see, it's really confusing to me. Having done budgets before, this is very confusing to me and trying to figure out how those numbers come. Because if we look at the, if we look at what the 6-month actual was on the LNAs, I'm not sure that, so I don't know where the difference is in the, the next quarter. The numbers are a little different, whether we hired people or what, at least when I figured out the numbers, so it was a little confusing.
and then that's
The number you're looking at, 6 months doesn't have the.
Right, right.
I had a note on why I asked.
Yeah, we also had that the retirement, if I remember, came into these numbers because Julie was telling us, and refreshing our memory that we don't pay retirement on it, the per diem or the part-time.
It was.
And we also have a big increase in the retirement, and we weren't sure how that, worked with the number of part-time and the per diems you have. Because you can't just take the percentage like we do for the full-time employees. And that also seemed like quite a large jump.
I think if I try to answer that question, I think it's related to the fact that, and when we had open positions when we put this current fiscal year's budget together, and so as we added those, added people into those positions, that's where you're gonna see the retirement increase there.
Which is also a reason why doing it annualized is making budgeting really hard, because those empty positions weren't forecast. And now we fill them, which is great, because we need that staff, but it's making the budget in a very hard budget year, harder to figure out.
So I guess what the question is, can we add anything that things we
Reconcile.
can do? Yeah, to sort of reconcile in those areas, I think.
I guess it's the numbers that Julie was thinking of versus the numbers that we have here. Is there any way to reconcile that or to figure out what the best number is for us?
You look at the bottom line, and it's $2 million more. It was a pretty, we're trying to look at the biggest numbers first in the work that we're doing, and this one was a big one, so. So that's why there's more scrutiny on this.
Well, and of course, we want to give all our residents excellent care, and we know we have a higher census, so recognizing those two things, but still trying to come to grips on how this is together.
So then it seems, Julie, any input about the current question about what numbers to, if there's a discrepancy between one method and another?
I'm still trying to
Process.
process it and understand it in my brain, and so it's, I think I need more time to think about it, or I can answer your question.
Okay, before we can figure out if that number could be reduced at all.
Can you give me the number that you had through March 31st on those different lines?
Was annualized.
Just, well, you said when you looked at, do you have just the hard numbers of?
I don't with me, no.
Okay, because that would be helpful to figure it out, because I know you said you added money here, to give a Patty and
Just a little
whatnot.
bit, yes.
But with the amount we have, every tiny bit we have to account for.
No,
So- It's really, oh, and I might have the revenue numbers or the expense numbers.
Which lines are we looking at? The LNA?
Yeah, so the LNA line through 9 months. But these numbers are tiny.
No.
3,873,783 58. The LPN line is $1,075,130.33. And the RN line is 1,224,57.31. I feel like my eye doctors.
Yeah. Keep changing my glasses. And it's good we do this in the morning. My eyes get very tired at night and I see worse, so.
Do you know why the contract line is, I know right now we're projecting that it's going to be like 112,000 for 3 months, so it's gonna be overexpended, just, it's a matter of how much. With all 3 of those salary lines also being overexpended, I think this is the first time I've seen that happen. Normally, there's a surplus in one or the other. You know what's causing that?
I think beginning of the year, we used more contract nursing staff as we were, still had open nursing positions. LNA positions as the students that were in that last year's class around this time. Getting ready to graduate, and so I think we had a higher usage rate of contract nursing. That just kind of continued the first half of the year, I would imagine.
I mean, I don't know what other questions you want about the nursing home budget this.
No, it was just, it was mostly, it was just the salary line and the methodology. Good morning. Everybody's really happy to be here.
Yes, yes. We also had a question, understanding that it's, helpful for staff and you're looking to extend it to the residents of the Reiki. You know, in our huge budget, in some ways it doesn't seem like a lot. But with I believe it's 9,000 for the staff and another 8,000. You know, so that's 17,000 and, we're just wondering how that, how you see that is for both groups. And we did have some questions about, if we're paying for it, should we do it for just the residents? If it's going to help their health versus a perk for the, employees.
You know, I guess I would say, based on the number of residents that have received it, there has been a benefit. The, you know, the staff piece of it, we very rarely have an opening on the day that she's here to see staff. So, you know, I guess taking it away from the staff, I would look at that as would be something, I guess, that I wouldn't want to do. For the number of residents that had been receiving it, I think we were anticipating with the request to add it, to expand it this year, this coming fiscal year. It was with the hope that more residents would participate in it, but I can't guarantee that that would be utilized. You know, because not all residents might want to receive it or might not understand it or just be totally, no, I don't want anything to do with it. So there's a certain element of projection that there would be a need for it with that request. I know it's a known with the staff that there's a true benefit with that, and so what I would, look to do is anticipate keeping it with the staff, and then any residents that there was a staff person that didn't an empty slot in the schedule or something, then we know there's certain residents that are benefiting from it, and we would, kind of fill those folks in, so.
That makes sense. So it was a,
There was an intent to expand the program.
right,
or-
but not necessarily because you're dealing with a very different and elderly group of people and there might not be as many takers
Correct.
as. So how long have we offered Reiki to the staff?
It's been 2 years now, yeah, 2 years.
And the feedback is being,
It's been positive, very positive all year, so.
Oh, go ahead.
I was gonna ask about a different.
I'm going back to salaries, so ask what you want to ask. I've been trying to use my calculator and I'm just trying to,
I was interested in the housekeeping piece of it and the transition that's going on there. And just making sure that, that was effective, gonna be effective. I think that was an increase. I know you said we were losing probably a collective 70 years of experience. And to replace the director. But there was a pretty big increase there. So can you talk about that again? And are there any other options around?
Yeah, really the intent is our assistant environmental services director. Are anticipating is going to be taking over a full-time role of director of the department in November of 2027. What that request for was for a half-year position to backfill her so that she can spend more time training with the current director. She is not as well versed in the laundry side of the operation within the environmental services department, and so when it comes to operating the machinery, understanding how the machinery works, handling more of the personnel management within the laundry department. She handles the personnel management in the housekeeping department, so being more involved on a hands-on operation overall within laundry, and just learning about, the ordering of equipment and supplies and whatnot. There was the intent to have more opportunity to train one-on-one without losing anything, with not having her own floor. So that's why the request is essentially to backfill her position to allow that to happen.
and you're looking that the training would need a 6-month position. You said it's backfill it for 6 months. Do you think that there would be a way to have that a shorter transition period?
I think given the challenges that we have seen with trying to fill environmental services positions, housekeeping in particular, to tell you that those dollars are going to be spent on January 1st, I can't, because I don't think that we're going to be able to hire somebody right on January 1st. I think it's probably going to take probably a couple of months of posting and seeing what's out there for applicants. So that funding would be available. If I had to guess without being held to this statement, I would imagine that we wouldn't start spending those funds until probably, March of next year. So if we were to, instead of filling or having funding available on January 1st, if we waited until March, or maybe April and fund it for that for like maybe the last 2 or 3 months. I think that same lag in having funding available and being able to hire somebody is going to be there, and then we're shrinking the amount of time. is available for cross training. So, but again, as with any pending discussion on the salary lines, I'm open to, feedback from the board, of what you think is best, fiscally best. Again, if you want to fund the position for, 6 months, 3 months, or have it be part of the FY 28 request. We'll do what is ultimately best, so.
So, not having hired for environmental services, this is just a point of information. Are you able to, and this may also be a county question, able to post a position with a date that it's available? I mean, like, there's times, in healthcare that, something's a bit, the position's going to be open on July 1, but they get that applicants before that. And knowing when, and I don't know if that's something that you would be able to do. Because I understand the overlap is important, but, not necessarily funding it for the entire 6 months.
I can't answer that question. I think that would be probably a better question to refer to Karen
Karen?
Clough and Human Resources. Yeah, I wouldn't want to speak out of turn on that, so.
I think if the position is approved to start January 1st, we certainly can start advertising prior to January 1st to have an effective date of January 1 that we do the hire.
So if we wanted to shorten that and say, approve it to start April 1st, we could start advertising before then. Okay.
Karen's on too, by the way.
Oh, good. Oh, so can we have Karen answer that question?
If she's,
Hey, Karen, I think that Sid can make her do something.
she's actively on.
Yeah.
now.
Yeah.
Karen, are you on the Teams right now?
Oh, we can get back to
I
it.
think she's giving us her answer.
Okay.
So I have, are we done with that question? 'Cause I have another question going back to salaries. If we're at a place to go back to that. Okay, my question is, how did, you said you added a little bit for a cushion. How did you come up with that number?
Yes, we discussed, we both came up with the numbers, we discussed it. And came up with kind of a middle ground. He was on the higher end, I was on the lower end, so we won't have one.
So it was just a number you came up with and not calculations
Correct.
or just kind of a feeling of what will
Right.
happen with staff.
Yes.
With your experience.
Right, yes, exactly. I didn't mean to sound dismissive. I apologize. I did not mean to sound dismissive.
So and from the paper that Julie just gave us, the
Yeah.
nursing home,
But, oh,
sorry,
yeah.
the nursing home temporary position, even starting in,
Yeah, it's only a little bit of money.
it's only $12,693.77 compared to the other positions that we're talking about.
It was just like
to throw any shade there.
Yeah, so, right. But we're asking everything because we want to be able to, have a reasonable budget and not hurt any one department, is the way I'm looking at it. We don't want to unduly hurt one department.
The only other note I had on increases was that dietary, the contract services.
Uh,
Yeah.
Yeah.
And I understand that's been very helpful and probably with more residents, taking up more time. But I did want to just. Yeah, 13, page 13.
Yeah, where's the, what am I missing? Where's on diet?
Dietitian, it's like the second one right down.
Oh, goodness sake. Yeah.
I think as I had mentioned, during the presentation, that, we budgeted based on an individual being in that position that is not currently the one that's in it now. So, they were at a lower rate, and that's the figure that we used there. So we brought our current dietitian in at a higher contracted rate.
Okay.
And you
And that
stated that
works.
she's really been doing a good job and has really
Yeah.
been
Yeah.
proactive in
Yeah.
helping with with the dietary needs.
Which is why we had proposed to add another $2 onto her rate.
Not for me.
I think I asked my question.
Thank you. Not for me.
And then I do think that it's important, I think we can just ask about the capital reserve, we understand that's not, coming out directly out of the budget. However, it will be. Karen's here, and I'm gonna be
Oh, okay.
So we'll finish this on Karen, we do have a question for you after that. So just in concern that this is gonna be, we're not gonna be able to replenish that. And just making sure, you know, that the requests are balanced with that knowledge and use.
And prioritized from your point of view. Yes, yes, because our priorities may not be yours.
Whether it's this year or next year, when there's very little left.
Okay, so the capital reserve, the requests are 168, 285, and the current balance is 254. 402, okay.
No, our current request is 240.
Oh, I'm sorry, I'm reading the wrong, I'm sorry. Oh,
And I'm trying to remember, Julie, what was the number that is left in there?
254, 402. I got that one right.
Got
Yeah,
that,
yeah.
okay.
254, 402.02.
So that's
So it leaves us 14.
14,000.
14,000. Oh, okay.
All right.
So how do you feel about that? I guess that's the.
Well, I think, yeah, I think as Julie commented yesterday, is there has to be a plan to figure out how to fund that going forward, because we relied on excess within ProShare as a method to do so, and if the ProShare payments are going to be in the vicinity of where we're at now going forward, you're either gonna sacrifice it on the revenue side for the nursing home, or have to come up with an expense
Yeah.
transfer into the capital reserve account.
So there's 1.8 in the budget right now as revenue, did we leave it at that number?
We were budgeted to 1.9.
Well, that was a
That was
proposal,
a
that's
proposal.
something. for the board
One
to
of the, what he
discuss.
said we could do.
And then
The current year's budget is 2.6, and we're only gonna get 1.9.
Well, I'm just saying, I mean, we could use the 1.8 and put the 100,000 if it appears, or whatever isn't above a certain number into the reserve.
Also go back, prioritize this as well, so that.
Yeah, that would be
Yeah,
very
thanks.
helpful. Because I know you mentioned some of them are an upfront cost, but that will give us cost savings. And those were things that that would be, other than safety, which would obviously be my first priority, would be the, to do that with ones that can create efficiencies.
Yes, that was.
Yeah.
I get this budget, so.
I think I would just ask if, and this is probably not, I don't think the board has had this type of a discussion, but you know, if there is kind of an overall goal of reduction within the nursing home budget as a whole, if you could let me know what that is, we can go back to the board here.
Thank
and
you.
make those reductions, and so
Thank you.
if you give us a dollar amount, we can work
Yeah.
with that. and-
Thank you.
and make the-
We did not come up with a dollar amount, but I think it was Commissioner Piper who said we need to, you suggested that we should look to do that, to give a number and have people make their cuts and get back to us. You did
Yes.
mention that.
Yes, start the negotiations. Yes, so, yeah.
So there's just one, I think one other question that relates to your budget, and to some others, but there's been some discussion around, and last year this was brought in, to add the position on campus security.
Right.
And that part of that would be filling needs that you have in the nursing home. We had gotten to the point of a position description and had done quite a bit of work on that. And so this is coming back up again as a recommendation from the Joint Loss Committee, the Safety Committee of the Joint Loss Committee. Whatever. So anyway, I'm just looking for your thoughts on that and how important that is. Is there a reason it wasn't included in your budget?
I think given what we were, looking at as a county budget as a whole, and the challenges that we're gonna be faced this year, that's why it wasn't included. That doesn't mean that I don't feel it's important. From the nursing home's perspective, the position was gonna be funded partly through the nursing home, 50% through the nursing home, and then 50% through the county. To serve as an overall campus safety and emergency preparedness coordinator. From my perspective in the nursing home, as I think I shared last year when I was trying to justify the inclusion for it, the emergency preparedness regulations continue to just be a focus whenever there's a natural disaster event across the country or a safety issue that happens within a long-term care facility. Healthcare facilities in general, CMS is very, very focused on that and very closely examining emergency plans and response of the staff in addressing those specific situations. There's just not enough hours in my day to be able to truly do justice to the importance of training and being prepared for these types of situations. And so that's where this position was going to come in and focus on training, ensuring that the staff are incredibly well versed in the plan response, in doing drills and frequency of drills, of drilling against our plans and as they're written and tweaking as we go. But that's really what the intent of the position was from my perspective, and then replicating that across the board here on the county complex as well.
Thank you. I just want to add a note to that. From what I understood of the discussion on Tuesday, and I might be misremembering, but from what I understood of the discussion, it wasn't that the Joint Loss Committee out of hand, unprompted, recommended this position again. It's that the question was, there was a request to bring back together the security committee. And I think it was asked at the Joint Loss Committee, is that what's called, the Joint Loss, am I getting it right? The Joint Loss Committee, if there was any interest in reforming the security committee. And the response was no, because we came up with our final solution, was this position, which was not funded. So it's a little bit of a finer point than that, in that it wasn't actually proposed by anyone. Especially, I think, as you said, given this current budget year.
Yeah, and I'm certainly cognizant of that.
I know you
So,
are.
Yeah, we didn't want to, put that in.
Yeah.
At least from my perspective.
Yeah,
I
thank
didn't
you.
want to have
Nobody
a
did.
part-time
Yeah.
position in it, so.
Yeah.
And I think Karen's on,
Oh, yeah.
and so we've ignored her. But the question, if you're there. Because she came up, oh, there she is.
Oh, okay.
Karen, our question is can we post a position, and say, we were talking about the temporary nursing home position, which may be moved because it's not that much money, but if we want someone to start April 1st, when would you anticipate that we could start advertising with a start date and actually maybe get someone, for a temporary position to backfill at the nursing home?
Oh, we got the answer usually.
Right.
So, thanks anyway.
We could get the answer. and pass it
Yeah.
on.
Okay.
Yeah.
Yeah, okay.
Big world.
All right, we'll get that, looking at the dollar amount, it's not as much as I thought. Okay,
Right.
all right.
Thank you.
Yeah, yeah.
Yep. Okay.
All right.
I don't. Thank you, thanks for your time.
Thank you. Thank you for yours.
You take it. Get that one. We're gonna take a short break. Very good. Simply bad outcomes if you try. So. But I wanna. talk now. So I guess we wanna start on page 1 with 6,100.
Yeah, what I have written down. The 6,100 line is up by 23.2%.
Increase in inmate population. New positions are about 600,000.
600,000 of
that.
a million, well, yeah, 600,000 for.
So that qualifies as a big number. Yeah. Well, I guess that's where we should start with the 003 correctional officers. And so the question maybe is, we're talking about in this budget, reinstating 2 full-time equivalents. And so we want to ask about what maybe reinstating 1 of those positions instead of 2, what that might, what you might be able to do. We understood what you could do with 2 of them. What would happen if we could only do 1?
We would sit down with the command staff, and would look at various scenarios, how we could best use them. We can definitely use them. Probably what I think my front runner concept would be, we currently have officers work a 4 to midnight shift. That's hours the inmates are awake outside of their cells, not locked down, but we don't have the administrative and command staff there. Because in an emergency during business hours, there's a lot of extra, the captain, lieutenants, me, we can all run to those. So I think what I would look at is pulling 1 of those positions down, combining it with the other funded, the newly funded position, and trying to address the issue on our maximum custody, highest level housing area that way. And then kind of figuring out how we deal with that 4 to 12 gap where it would still exist, how to best deal with that.
I have a follow-up to that. So there's 2 that were removed from the 22, not 1. And Commissioner McLeod is asking if you had to have 1, what if there were no new corrections officers?
We would probably continue to operate as we are.
Okay, thank you.
That, to my knowledge, has not resulted in a major
Thank you.
negative event. It's one of those things that it's predictable and it's therefore preventable. But I recognize it takes funding in a very, very tough fiscal year.
We heard some issues around corrections officers being in by themselves, having to bring in tools with them or whatever, but how is that impacted in terms of their safety without?
Without the position, again, we'll be operating the way we are, getting into the details of our security vulnerabilities and our emergency responses. I don't know,
Okay,
Yeah,
if you want to do that in a public meeting.
No, that's fine.
do we want to go into a non-public to talk about that? Well, we've got everyone here.
I don't. I just, I asked that question because about what would happen if there were none. And I really appreciate the superintendent's response, that they would continue to operate as they are. And so to piece it out, like, well, so what about safety? I mean, it seems to me that to say there have been no major incidents, and we would continue to operate the way we are, suggests to me that this is, and forgive me for this language, that this is a want versus a need. And with a budget that is still at a 16% increase from the other day, with a budget that is still at that for Grafton County taxpayers, I don't feel the reason to go into a non-public session to talk about security, because I think I've already been given the answer to the question that I asked.
I mean, I don't feel that.
So I would respectfully disagree, but I would also wonder if we would, whether it would be best to also talk about the nursing positions that we've had in the
Yeah.
absence, because there may be some security concerns also that we might want to ask instead of going in, and we may not, but instead, if we're going to go in for a reason of security, maybe we get all the questions we can that are not going to impact your current security plans and details and whatnot. Instead of then going back in or not getting an answer, would be my thought.
That sounds good to me. If it impacts your decision, you will be inspecting us
Yes.
next week. We always try and pick an area kind of maybe to focus on and do a little educational component. I am planning to use that housing unit as
Good.
That's
on
great.
Tuesday.
That's great. So I don't know if, how others think about that, but I do have questions that would be good to ask now, and then we can see them
Sure.
next week, so.
I remain very concerned about the nurses.
Yes.
Absolutely.
And I'm very concerned about the vulnerabilities of the staff.
And,
Yes.
Could I speak broadly to Commissioner Piper? You describing it as a want versus a need. I think it's more like, it'd be very similar to the bulletproof vests that street law enforcement. I wore one my entire career. It never stopped a bullet. But there's an officer in Ashland who probably, I don't know the details. I can't say whether he was the best safe.
Right.
But I imagine he was very grateful that he was wearing it.
I understand.
And that's kind of the situation. We recognize vulnerability. There are things we can do to minimize that, and they would significantly minimize it. The fact that we haven't had a bad event doesn't mean we won't. But it also, that bad event could be 20 years down the road. I can't tell you. But when that bill will come due.
We've had an increase of 20% in our inmates. So it's not that it could not be, it's not that we can't justify, and we're relying on you in terms of how that population is managed. And so I think that's a lot of what we'll want to see next week. I think where that increase is and how those folks have managed. And obviously, in the general population or whatever, maximum as well as in the medical areas. So do we want to, let's see,
Nursing.
do you want to talk about the medical personnel?
Broadly, I can tell you that the night shift supervisors have told me it has been a lifesaver for them. One sergeant told me there's been 3 ER trips that would have gone absent a nurse in the building who could do the assessment that he needed and make the decision that the inmate was stable. The big issue that we face, if it was just an increase of inmate population running on the kind of trends that had existed for decades at the point I was beginning my career, where young people committed crimes.
Yeah.
We wouldn't be necessarily dealing with a crisis in nursing. I've had staff working on extracting data from our JMS system. My broad perception was that we were in line with the rest of the country, seeing a massive graying of the inmate population. And we definitely are. And I apologize, I probably should have made 3 copies of this, but
We can share.
it shows a breakdown for each year that we have our current software, how the population broke down. The 18 to 29-year-old inmate population is decreasing. And the population over 40, over 50 and over 60 is increasing year after year.
It's not that unusual though, when you consider that our younger population is in fact.
That's so this-
increasing in the county and the
yes.
state.
That's probably one factor.
Yeah.
And our trend seems to be sharper than the country as a whole, which has been experiencing this over the last decade or more, where pretty much since 2020, there's just a big spike. And it's because of that the nursing staff, really, they're handling a lot of very fragile inmates. We have a hospital detail going right now, an inmate down in Dartmouth who suffered a stroke. Mid-60s in age. When I went to pull that inmate up to make sure I was familiar with what inmate was at the hospital, I noted in his medical notes, 5 heart attacks since
Oh my gosh.
2025. Our nursing staff do a lot to try and keep these people stable, so they
Right.
don't have to go out and try and avoid these major medical expenses, but they are very fragile. And my biggest concern that Shay has expressed to me multiple times is if we don't address the need,
Mhm.
nurses will start looking for other
Yeah.
places to work. And the nurses are hard to fill anywhere, and correctional nursing takes a special person. So I don't want that outcome if I can avoid it.
We did have one other question, and this is certainly respecting all the nursing needs. It's one of the things you shared with us when we were adding the 2 temporary positions that we have now till we get to the budget, is you've talked about how long it now takes to pass meds. Would there be any role for having like, medication, LNA, just to do the med passes and then have the nurses to cover the other shifts?
It's a great question because I asked. the same.
Yeah. No, not really, because MedPac time is basically sick call as well for the units, so it has to be a nurse. So if you had an M&A doing MedPass, which is for 75 people, I'll share a story about that in a second. The nurse would have to come down for any sick call assessments because M&As can't
Okay.
do a physical assessment on an individual for a reported issue. So the nurse would have to be involved in MedPass too, and we have a fair amount of individuals that are on the withdrawal protocol, which is a hefty protocol, so the nurse would have to do that as well. So I don't think there would be a great deal of benefit in that. And so just the story that I was gonna share was, the 2 travelers that we have now, who are great, by the way, who are both very experienced.
LNA.
They're LPNs,
Okay.
yeah, and they both traveled. I think Claire has worked here at the nursing home for years as a traveler. And when they first started, and still, they started in March, they said, well, we cannot believe this MedPass. And Claire's first week, she said, so 2 nurses do the MedPass, right? I said, no, there's just one, because there's only 1 nurse. And she said, for this many people, I said, yes, I understand, it's very challenging. So they're both continue to be blown away by the magnitude of the evening MedPass. So it can be a bit overwhelming, shall we say. So, which is why, experienced nurses are very valuable in that environment. And it's obviously a different environment than working in a nursing home, and you're dealing with not only chronic and acute medical issues, but substantial amount of mental health issues and substance use disorder. And it's just a lot. It's a lot. So we've been very thankful for them. They've been wonderful.
And we're thankful you have them. That was just, I don't know, it might have been Commissioner McLeod who asked it first, so I jumped in.
So with that being said, there would have to be a nurse in the building with an M&A at all times anyway, because they can't practice independently. So if the goal were to have no overnight nursing and just an M&A there with, say, like an evening shift, is what we're calling like the swing shift now, and not have overnight nursing.
Doesn't help the overnight
Yeah,
issues we don't have it. Okay, thank you.
I mean, I think it's all justifiable, I guess is the word. I don't know, when I looked at it, I thought the only thing that really we could perhaps compromise on was, one CEO instead of two.
I had a couple of other questions that I think we came up with some of the other, we know there's been a 20% increase in population. And in our discussion, and this was a question for you, we didn't know of any legislation that we thought was going to continue to have this rise in population other than the big increase we had over the last few months that we might be stabilizing out in this low, 100 or low 100. Or is it, we wanted to make sure we weren't missing something.
No, I believe you're correct. There's no major threat legislation that I think is going to have a significant increase. And, yeah, I'm kind of running with an estimate of the low hundreds for our population going forward.
What do you do with the DUIs? I know that was a change in the law.
On
It's just how long they lose their license.
Okay, but they don't, it doesn't mean that there's more, people.
No. I think there's a broad trend in the state towards a more incarceration model.
Mhm.
I'm not here arguing against some of those changes. I've seen people released from our facility that left me scratching my head that they were being given personal recognizance bond. It's just, everyone needs to understand there's expenses that go with
Yeah, right.
holding more of them in custody.
Right, and that they are really on the property taxpayer again, is where the downshift is. So it's easy to make changes in the law without really thinking about who's gonna pay for it when you do that. And we do have a law enforcement heavy administration, executive administration at the moment in the state, so.
So one of the questions we had when we were discussing are things like the prisoner clothing and supplies. It's a 20% increase in population and 100% increase in the department request.
So one issue we ran into as the population increased, and 20%, that's a year over year. I'm assuming we've had a steady increase pretty much since you guys hired me. The jail population today I interviewed was 55. And, we're running in the 90s now. So it's more, in a relatively short period, almost a doubling of the number of inmates. What we had was supplies to house inmates had been allowed to be drawn down over time. During COVID, when census was very low, you have 150 beds. If you have 40 inmates, do you need to have 150 mattresses in stock for those beds? Or do you just keep burning through the mattresses you've got, keep your budget low? And I understand making that decision that way, but now we've had to go rebuild where we're running out of mattresses at the population levels we're running. Because a jail is not a hotel, and each bed is not equally available to any person. When we're getting close to 80% full rate, almost guaranteed, one of our housing units is over capacity. So, or we have too many inmates who can't climb into a top bunk, and therefore we need to use these portable bunks that we put on the floor. We ran out of those and had to buy more of them. Inmate clothing, we just didn't have enough, and we've had to rebuild so that we can adequately clothe all of them.
And then I think I'm sorry, may I go ahead with my next one? And then the next question, I think I know the answer, but I'm gonna ask anyway, is we've had obviously long discussions about the high acuity medical in the jail. Again, the amount requested is a little over double that was in last year's budget, and we know we've been going through that. The question is, and I think you said yes, but I'm gonna ask again, that we're anticipating that amount medical expenses, but then my question with that is, because you've mentioned it, what savings might we have on that medical dental ambulance line with having overnight nurses? Because you've said we, just since they've been there, we've saved some emergency room visits, which is great on many levels, but I didn't know if that would affect the medical dental ambulance line, which is the 6,100 590.
Good
I think
question.
that unless you have a-
You would be more, have more expertise, I believe.
So I do believe that we will significantly decrease the number of ER visits that we have, having nursing staff overnight. However, given the aging population and then the acuity of the individuals coming in, we're requiring more specialty appointments. Say Sunny People's Department, or they're nephrostomy bags, they're stoma bags, they have to go see the GI doctor, or, people come in, they have cancer, we have to send them for oncology. Individuals had the stroke, he sees a cardiologist. So another individual, they have to go to a cardiologist every 6 months. So given the aging population and then the acuity of their medical issues, and then let's just say the acuity of some of their crimes are staying with us for much longer than they used to. So these individuals we're having many more specialty appointments, and we're having to send people to Dartmouth for appointments.
And these inmates are not, may be eligible for early release because of their age or their,
So we definitely look at, especially our high medical acuity inmates, to see what our options are. And there are times when potentially the DOC is on the other side from our law enforcement partners on those issues. The particular case of the individuals out right now, no, there's no way I'd go to a judge or a prosecutor and ask them to let this person out on anything else.
okay.
Unfortunately, yeah.
We definitely do, and we utilize that to reduce these expenses, but all along, we've been maxing that up. We've always done that.
They're community corrections works very well with us and myself and the superintendent about, can we possibly just get this person out of the building because I can't. It's very challenging to care for them and they're very expensive. So we try really hard on that. Unfortunately, we have a fair amount of individuals now who are requiring a great deal of medical care whose charges are violent, having medical issues and preclude them from doing something that's going to keep them in jail for quite a while.
So I've asked my other questions, I think, on the ones that I had highlighted before, because we talked some things, and Julie, I believe we take in the money that we approved that we would use some opioid abatement money for 37,000. That's been already counted that
Not accounted,
in ours, but you did it in.
it's not accounted for in the numbers I gave you last week, but it is, I have a whole new.
Right. But you've already, that's what I said, I know it's not in my book, because I've had this one for a while and I've been scribbling notes in it, but you have accounted for that. So when we get the next set of numbers, that will already be in there.
We also talked about using ARPA interest or TCF on some of the capital.
Right.
So I have, can I ask a
Yeah.
question? So I met with the superintendent and Jean earlier this week, and I guess my question is, are there any areas where we can make any deductions to the budget?
We're working on that right now. Jean prepared this budget with a lot of input from me, and one of the, I'm gonna be honest, it's been embarrassing to me to keep coming back to you every month and saying, I've got a budget crisis, I've got a budget. I've never come in over budget in any area that I've ever been responsible for. And I don't want to do that next year. Didn't like it. It's not that I had any negative reaction. You've been more than gracious, but that's an embarrassing position to be responsible for an organization and say, I can't make it work with the amount of money I have. So can we carve off some of our estimates? That's what we're looking at. It just makes it more likely I'm going to be in that position, and I don't like it. I don't know if creating a separate contingency fund is would help in any way. And I know it takes the money this budget year, but not. But yes, the answer, Julie, would be we're going through right now. You pretty much sent us out of that meeting with get out your red pen and get prepared to start cutting. And we have been working on it. We're not done. I haven't gone through everything.
So when we move over the opioid money, I'm not gonna really speak of the 16100 line because I've not discussed it with the superintendent yet. But the 6115 line, which is community corrections, if we move that over, that would drop that down to a 10.8% increase. The 6125 line, which is our programs, there's no place to cut. That line's basically just their salaries. There's just,
Why is there overtime, so much overtime in that budget for programs?
So that's the same group that's responsible for like bringing in AA when ministers come and visit. It's often program staff who are coming in supervise.
Their schedules can't be altered to their week be still 40 hours a week.
I can look more closely at that
I
if
just
you like.
think that's a tremendous amount of overtime for.
Can you point us to what you're referring to?
No. You don't have the, it's the 6125 budget I'm talking about.
But we
No,
don't
you
have
don't have a
to break down
breakdown.
the salaries.
Salary. I have a lot more information than you do.
I bet.
Okay.
Yeah, I don't have that copy of my overtime.
I think I copied you gave me. I think there's $20,606 in there for overtime. And I'm assuming that mostly one particular staff member.
Mostly, I think.
Yes.
Well, right out there.
Yeah, I value your guidance and your input, so I will take a close look at that as Gene and I continue to work through the budget.
I will say that there are classes that they do Monday through Friday and programs, because we work very closely together, obviously with the substance use crisis that we're in, are full to the max. They have a wait list and they have to separate obviously the men and the women for class. And so during the normal business operating hours, they're doing class mostly, and then their individual sessions that they have to do for their programs, ASAM. So that part I can speak to. I know that the class is completely full and there's a wait list to get in for the substance use disorder class, which is wonderful for us that we offer that, and it's 5 days a week. It's extremely beneficial to obviously all of our.
Wow. It's too bad there's a wait list. Is there a study of some kind? that-
Yes. They do offer like DBT workbooks and that do so. They work a lot with coping skills and mechanisms, as I'm sure you can imagine. So
Yeah.
very helpful for the medical team.
And sometimes we're in a situation where there's a wait list for one gender, but
Yeah.
vacancies for the other gender.
Right.
Mixing those two together would be a very bad idea.
They would probably like it, but
I guess, yeah, at this point, we should give you all time to work on some of these and then talk about this next week when we're over there. Is that?
And I guess my question for both of you is, since we're going to be doing the tour, do we need the non-public session today to ask questions, or we'll be able to see in real time what's happening? And that would probably answer our questions.
That's good.
If Tuesday is timely enough for you, I think being present and physically seeing, I think would be the best way to
Okay.
explain it.
I'm okay with that.
I'm okay with that. I wasn't, thank you for your answer, because I was trying to figure that out.
You'd sent out an email, Julie, about capital items. Should we be discussing that in this meeting? Because I have reached out to Jim to get his input on more maintenance.
Sure, that'd be great.
So Jim's input was the dishwasher, which is the most expensive component, is his top priority between that and the dryer. The dryer is currently working. But they know because its sister dryer that was replaced last year were installed at the same time. parts were not available to fix either of them, it's going to die at some point and maintenance will not be able to repair.
We all are.
But this is the mood you're walking into. So,
It's a dark budget meeting. Existentialism.
Just wait.
If it were to die, and they couldn't cobble it back together or jury rig it some way, then, we'd look at our alternatives. Maybe we could work with the nursing home if they had extra dryer capacity to get through the rest of the budget year. Maybe in my facility in Florida, we went from like doing a 12-hour laundry schedule to going to a 16-hour laundry schedule when our numbers went up and we ran the laundry harder. So I may have to adjust in that way. But the dishwasher it's described as very last legs. It's a constant maintenance issue. Maintenance is always working on it. Again, parts are not available for the equipment we have, and maintenance does not think they can keep it going long term. The cameras are always going to remain a priority for us, but that is a long project. We're currently have 28 cameras. We've upgraded to a digital standard with a much higher resolution. That leaves us with 119 more to go. So we're asking for 7, but
Very long term.
it's a multi-year project. Next year's cameras, we're going to be installed in the kitchen, which is an area where we do have a lot of incidents, because we use inmate workers in there and, so a fair bit of contraband smuggling as they try and get sugars or other things back to the housing unit. They may be able to create, ad hoc alcohol out of. Oh, they're inmates are everything.
Big old book on it. That you can read before you go.
People would They would think it was fake. You're making it up.
I would like when we,
Sort of like survival island too, right? What do you need beforehand and you figure it all out?
so I have a whole section on capital to go over with you. It's good to get the information that the superintendent has, and then I have some recommendations for us for how to
See what that-
deal with that.
Thank you.
Good. All right.
Thank you.
Thank you, commissioners.
We'll be in touch.
I'll keep working.
Did we miss something?
I don't, so the question Shay asked was, are we gonna talk about extending the travelers? Because the travelers contract is going to expire, June 6th. They've already reached out to ask if we intend to extend. I know you approved funding 2 cycles. My basic feeling is that if we're not going to fund the 2 nursing positions, at some point in the future, we're ripping the Band-Aid off and we're not gonna have night nursing. I don't know that it makes sense to extend another 13-week of travelers if we're not, we might as well rip the Band-Aid off in June as in September. But that's kind of my thoughts on it.
Well, we're gonna have to do something because the budget won't be passed until the end of June.
But,
We've got at least,
yeah, right.
and then we've got time to hire, so.
But if coming from the commissioners, the decision is that we are intending to fund 2 positions, then I think I would seek to extend the nursing. I know coming from the commissioners, the money's not there for those 2 positions and we're not going to have them.
You're gonna know that in the next couple weeks.
That was my
The
thinking.
commissioner's budget is gonna have to be done by May, maybe at the latest, so.
And I know the executive committee is not going to be adding 2 nursing positions to a budget you've approved. They'll cut, but they're not putting anything else in for me. So at that point, I think is when we decide and ask for the second extension or we decide we're not.
Good question.
Thank you very much. For the rest of your day.
Thank you. After Julie's comment, I'm going to go over to my Marcus Aurelius and
You can get some meaning back in your life.
right.
All right.
Carrie?
Yeah.
Well, I contemplated making a joke, but then I couldn't really come up with one that. And it probably wouldn't be appropriate.
So. I have. Full packets for you of of the budget, sort of as it was presented. Which I don't know if you want or you don't want, but like when we talk about the capital, it shows all the capitals
Yeah,
together.
please, that'd be great.
It shows, I mean, unless you need your notes, you don't need, you're not needing to flip through all the pages. This is the first 3 pages of the revenue and then the rest of it is. The rest of it is, the expense budget. So I think the first thing I'd like to take a minute and talk about and actually get the commissioners to make a decision on, is health insurance. We have come to a tentative agreement with the United Electrical Workers who represent the members of the nursing home that are covered by the bargaining unit, as well as had buy-in from the employee council. So the recommendation is that we would switch from Health Trust, the anthem coverage that we have, to Harvard Pilgrim effective July 1st. We'll have 2 plans. We'll have the higher cost plan, which will have a 25% employee contribution to it. And we would have the lower cost plan, which through our negotiations, we agreed to a 12% employee contribution, which is an increase from what the employees contribute now. So we would continue the HRA contributions for the low cost plan, as well as we did through negotiations come to an agreement of a $250 FSA contribution. All of that said, what that does is reduces the budget as a whole from where you are at to $560,000-ish. So Karen needs to move forward with notifying Health Trust of our termination and getting everything started with Harvard Pilgrim, including employee education sessions, all the enrollments that need to be done, all the setup that needs to be done, and we have to have notification to Health Trust by April 29th, I think. So therefore, I am asking the board.
Gonna vote on that.
Yes.
Okay.
And I don't, Karen's on, I don't know if she has anything to add.
One question I just have, just so folks know this, does mean that we have to do this for 2 years. Yes.
Well, it doesn't. It means we can't go back to Health Trust for 2 years.
Okay, you could go
We
somewhere
could
else,
self-fund,
but you
we
can't.
could, we also have a rate guarantee from Harvard Pilgrim of no more than 15% for next year.
Okay.
So we're gonna be working with a broker who will be able to have a lot more information, which will make the research into self-funded a lot more thorough. So we will have other options for next
Okay.
year.
Right, but we can't go back to health.
We cannot go back
Not
to
all
Health
the
Trust for
time.
2 years.
Yeah. So questions for Karen? Karen, are you able to talk to us? I know we couldn't hear anything before.
Oh, she could respond.
No.
You did, June herself.
Yeah. All right, well, she can't talk to you, I guess.
I can.
Are you there?
Yeah, she's in.
I think I don't know that actually. So I should say that.
Are there questions for her that we want to ask her to come?
There aren't from me. This change sounds like a very good idea, solid plan.
I think it's a reasonable option. I think switching insurance is always difficult on every level, from both the people who need to switch their insurance to the organization, and insurance is in a state of flux for many years. So I think we trying to go on the best information we have.
I will also add that, Anthem is going to allow us to leave our retirees with them set up exactly as they are, so there will be
Good.
no
Okay, but that's
disruption or change for the retiree population, which
Good.
is helpful.
very helpful.
And that's a Medicaid.
It's a Medicare Advantage
Advantage
plan.
plan, yeah.
They're gonna allow them to keep the exact plan setup they have. And
Do
just
and
be
do we
direct through
contribute
Anthem.
anything else to that plan besides what the Medicare Advantage plan does?
We pay 100% of a premium for anybody who qualifies for the retirees of either their Medicare Advantage plan or any under 65 retirees. We pay for the cost of the
Right.
lower cost health insurance plan for a single person.
Okay.
So going forward, if we make this switch, if someone is over 65 and qualifies for the Medicare, they would go on to the Anthem plan. And then someone who's under 65 would go into the plan that we currently have for our lower cost.
The
And the
low, they
low
only
cost.
have the
Yes, the
low
lower
cost.
cost option, yes.
Sounds like we have a consensus that we want to move forward. Do we want to take a vote on it? Do we want to make a motion? Do you do that?
Sure, I'll make a motion that we switch from our current health trust Anthem insurance plans to the proposal to
Anything else you want in that motion? Is that? Okay, all in favor? Aye. Motion passes. Yeah, well, I next year one thing.
So I think the easiest way to start is to give you this piece of paper. And I'll explain it because there are lots of numbers on it. But, so if you start at the top, the $63,514,035 is where we're starting off, our starting point for the budget. So if you look at those sheets that we gave you, if you look at the very end, that's the appropriation total. So then I have a bunch of adjustments. So social services, what you did reduced it by $210,093. The health insurance has a couple of different pieces to it. There's the premiums, then there's the FSA contributions that are decreased. And then there's an added for the employee assistance and the COBRA fees, because those are all contained within our health trust plan, but they're separate, going to be separate services under this plan. Then we move down, and the sheriff's department OT, the sheriff's department social security, and the sheriff's department retirement are all a result of the sheriff not taking advantage of the Northern Shield grant. She has opted out of that grant. So the expenses that were added into the budget for that are removed here. So you can see that. Tuesday, I told you that we had received our VOCA grant, but it was slightly less than what we had budgeted, what we had applied for. So you see the $6,415 reduction in the expenses.
but that's to match what we're getting.
When we get to the revenue side, you'll see.
Yeah.
Flip side of that. Then you'll see all of the reductions for all of the opioid requests from the jail. So it starts with consultant DOC opioid funds, medical opioid funds, community corrections, educational training, and then community corrections, substance abuse opioid. Then I went back through everywhere I could in the budget. And I had budgeted for a big increase in the employee benefit payout line, and decided to reduce that to 25,000, just based on looking at current stuff. Let's skip the capital for a second. I also under the contingency line item, I reduced the outside council line, based off of last year and this year's spending. I mean, that's a pretty unpredictable line item, but
Yeah.
we're gonna be significantly under what we budgeted this year for next year, so this year. I also reduced the county government promo line, small reduction, but it's $2,000.
Can you explain that to me?
So we have money in that county government promo line for the Association of Counties Conference. I think we put 6,000 in there and I reduced it by 2 to 4, which doesn't make that bad. Then the transfer of the dispatch capital reserve, I had 72,000 in there for the 10% of the capital reserve, which we had historically done. We've only done 5%. At least for the last 5+ years, so I reduced that down to 5% of the dispatch revenue, so that's what that reduction is. So with all those reductions, it brings, and we'll talk about the capital in more detail in a minute,
Yeah.
but that brings that to a 62,417,667. The next section is revenue, so our starting revenue, and this is just operating revenue, the 25,564,000. So we talked about adding in the revenue from the additional revenue that Craig suggested. That's that. The decrease in the sheriff's department is removing the Northern Shield land. Reduction in the VOCA grant obviously matches the deduction in the expenses up top. Then I took another look at some of the revenue line items and I put a $15,000 increase in for the abandoned property revenue that we have. Then part of our agreement with Harvard Pilgrim is they're giving us a $90,000 premium credit. So that will go in as a revenue line item. That's as well.
And that's just a credit, it's not something we'll need to repay next year.
Then we get to the surplus and we need to talk about that as well, so. You'll see in the paper that you have in front of you, we're using 1.7 right now in this current budget. I've reduced that to 1.5. And I'll go over that. Then you can see below that in the bold, it gives you the new numbers, and it comes up with the amount to be raised by taxes. It's the 35,074,000. And then just to have the math in front of you on one piece of paper, in comparison to last year, that's a 15.05% increase. I've done some math, and in order to get that to at least a single digit tax increase, we're looking at likely close to $2 million that we'll have to find in either increased revenues or decreased expense. Kind of where we're at.
That's how many, 2 million, you said?
Ish.
2 million.
2 million would get us down to 8 point something. So I wanted to go over the surplus stuff with you.
That's the question, we're going back up to the expenses, we have some decreases in sheriff's maintenance, jail and farm. I don't remember where we got those.
That's all the capital.
That's all,
Okay, so
And we'll talk about
so it's just all under capital. I didn't go for this a separate.
it. No, that's the
Okay.
capital heading and then it's.
Yeah.
which
Okay,
department listed.
great. Just wanted to make sure. Thank you.
So every year, starting in February, I start estimating out our surplus. And so this is through March 31st. And what I do is I take the current revenue, which is the 4733 at the very top. That's where we were at with revenue from March 31st, so those are actuals. Then I go through and I estimate out all the revenue by department for the rest of the fiscal year. And when we do that, we come up with operating revenues of 55.5 million. And then there's a couple of other things we have to add in from capital reserve and surcharges. So anyways, it puts us at 55,588,000 in revenues for the year. We do the same thing on the expense side, but do it a little bit differently because it's easier to capture like a significant cost as the payroll, so we can estimate out what our average payrolls are per week, and we can just put in the expense for what the number of payrolls left in the year. The health and human service bill is a constant, and we have funds to skip for that they just. Love that be wrong, but. No, just didn't. We have 3 left, and that's what the math is 3. I just didn't know. We know we'll spend all of our social services, so we just add in the payments for the social services. It's likely we'll spend all of the remaining bed tax money. Then we just estimate in $1 million of expenses a month, other than all of these particular specific expenses, so. Anyways, when we do that out, we end up at 57,064,466, and I think you can already see the problem that there's a $2 million, $1.5 million difference between the expenses and the revenues. Then we have to add in our encumbrance expenses and our capital reserve expenses, and then the broadband project expenditures for the year as well, so. Brings us out to 58.8 million in our expenditures. You flip on to the.
Can I ask a question about the broadband? Is any more money freed up from that project as we've gone through?
Absolutely not. Broadband project is a whole nother subject for a whole other day.
Okay, all right.
So on the back side is where we map it out. So starting at the top, that's our projected revenues. Then we add back in all of the existing fund balance from this current year, what all the next numbers are, and they're broken down into the categories, and then we subtract out the projected expenses, which leaves us with a projected fiscal year 26, not 25. Fund balance was 6.87, it's almost 6.8. Then we have to go through and we have to allocate it out for all of the things. The reserve for broadband is the rest of what's left of that 5.1 million, and that number. So the number on the front and that number change and sync with each other as we spend it down. The expenses increase, that decreases. And then we have encumbrances, we have inventory, we have our capital reserve accounts. And then we have whatever amount of money we allocate for surplus to use for to reduce taxes. And then that leaves us with whatever our undesignated fund balance is. As you all well know, our policy is between 8 and 16%. This leaves us at 3, which is not good. And were we in a different budget situation, I probably would be recommending we use much less surplus. But as we reduce whatever surplus we use, we increase the amount to be raised by taxes, so it's,
Right.
you know, we have to think about that and figure out where we wanna end up with that. That's where we're at, and that's the math on the surplus as of March 31st. I will redo it again. But I don't expect any dramatic changes, especially now that I know what the pro share payment is estimated at. You know. It's really basic math as we continue to spend close to what we're budgeting and we only bring in what we revenue.
Right.
We're budgeting in a deficit. We budget at a $1.7 million deficit.
Yeah.
You know, the goal is always to not use that 1.7 and to continue to build the surplus. But for the past few years, that's not where we've been at. So we keep reducing our surplus every year instead of building it. I have sent out a memo to all departments. I copied you on it, I think, asking for, the sort of, you know, conservancy as we go through the rest of the fiscal year, you know, but in reality, there's very little discretionary spending. We are, you know, between payroll and benefits and contracts and state bills and all of those things, there's already very set things that we're gonna spend money on throughout the rest of the fiscal year. So there's a very little portion of that we have any discretionary control over. But the memo has gone out and I have asked people to be very conscientious of what they're spending and throughout the balance of the fiscal year.
Just that that's how we budget this.
100% correct.
Yeah.
The higher we estimate our revenues and the tighter we budget our expenses, the more we exacerbate the surplus problem. So if we wanted to talk about, I'm happy to answer any more questions anybody has on that, but if we wanted to talk about the capital for a second, and you wanted to go, the page.
That's mine or yours. Mine's, I was using one as an.
Page 33, that I gave you. And when you go to my page, you see all kinds of writing and notes on it. So I did what you had asked me to, and I reached out to the departments about prioritizing, you know, their requests. And starting at the top of the sheriff, you know, the sheriff's priority is she needs 2 cruisers. We only bought one last year. We've done a three replacement cycle every year for a long time, so he needs 2 cruisers. The maintenance department, Jim's highest priority. I gotta find my other piece of paper.
Luckily, I have it all labeled so I can find things.
It's bad. Jim's number 1 priority was the underground storage tank sump repair of this. His second priority are go hand in hand, the asphalt crack sealing and the restriping. If you do one, you have to do the other. And then his third lowest priority was the engineering of the HVAC and refrigeration systems upgrade.
Oh, wait a minute, so the underground storage is the first, restripe and asphalt is the second.
Yeah, they go together. And then, as you heard from the superintendent, the dishwasher is the number 1 priority in the jail capital outlay requests. And then from the farm, the manure spreader is their most important request. The one manure spreader that they have is broken. Orchestra. Spreading manure. Yes. Don't worry, they're working on fixing it. So what I've done, and this is strictly for your discussion purposes, but as a starting point, I have included in the capital line items for each department. I've included 1 cruiser and one cruiser safety equipment. So that's $80,000 that we would budget in this budget for that. I included the underground storage tank sump repair of $7,645 for the maintenance department. Under the corrections department, I included both the dryer and the computer replacements, so that's $24,924.
Wait a minute, sorry, you said computer?
Yep, Cornerstone, the seven
oh,
operating cameras, I didn't mean computer, I meant camera, sorry.
Dishwasher and the cameras.
No, not the dishwasher,
You didn't include the,
nope. I included the first two, which totaled $24,924.
okay, so I'm sorry, the dryer. Okay.
Then on the farm, the breastboards aren't really a capital item at 2,500, they should be included in the operational budget, so I took that out completely. And I put the 8-foot tiller, the 9,500 in this budget. Okay, so the total for the capital outlay in the operating budget ended up being 122,069. And the reduction that you see on the first sheet we went over correlate to that. Then what I did was I said, okay, let's look at the other monies that we have. And if we take one cruiser and the safety equipment, which is another 80,000 out of the ARPA interest line. And then we take the asphalt crack sealing and the restriping, which totals $39,031, also out of ARPA interest. And we take the manure spreader out of ARPA interest. That's $173,031 out of ARPA interest, and I think we have 210,000.
Hey, can you go back through those again, because I got behind in writing, so we're doing the cruiser and the safety.
And then under maintenance, it would be the asphalt crack sealing and the restriping,
I thought you,
which totals 39,031.
I thought you included underground storage, you didn't.
Well, underground storage is
It's
included in the
operating.
budget, in the operating budget. And then,
Is that in the ARPA?
so that's a total of 173,031 out of the ARPA.
So are
Then
there
I-
any of these items?
Did the dryer in the jail out of the LATCF funds. With this would be easier for them.
So that covers.
I mean, the dishwasher, what did I say?
You know, the dryer.
Oh, no, I'm
I
sorry,
thought That was in the
dishwasher.
operating budget.
Sorry,
Okay.
that one, so. So that's a starting point for your discussion. You can go through and decide if none of those, if some of those you don't wanna do, some of them. But I wanna leave money in the capital budget because it's
Right.
important to leave money in the capital budget because it's going to go. All these other funding sources are going to disappear.
Go
We're gonna
away.
continue, the sheriff's gonna continue to need cruisers. You know, maintenance is gonna continue to have capital outlay across. The jail is gonna continue the computer replacement stuff. So try to look at the lower dollar stuff that will be a continuous, ongoing type of capital thing, because if you just zero it out, you're just gonna be, when all this other monies are gone, you're just gonna be looking for,
Right.
you know. Anyways,
But-
that's the
yeah.
theory behind why I did what I did.
It's like the position with the county attorney that was filled ARPA money that we're trying to, and now it's all on us that
Yeah.
the percentage decreased.
I'm gonna look, so we can spend ARPA money through December 31st. Gonna look at the ARPA under that position again and see, like, we had to designate. Last January, I think, how much we were gonna spend out of that. I need to look at that a little bit and see if there's any extra money that we can actually use out of ARPA to put towards that, but I just ran out of time, honestly, to look at that. I'm also gonna look again at the county cap. And just look a little bit closer at those numbers and see if there's any room I have in there as another avenue to look for reductions, so. Anyways, that's a whole other subject, but So I'll stop talking and you guys can talk about capital.
So with these changes on the sheet that you gave me, what's left in the capital outlay is 122,000.
And what I gave you on the face sheet where we talked about the reductions reflect that, those changes.
Yeah.
So when you see capital and then you see sheriff minus 80.
Yeah.
That's what those changes are.
And I'm glad to see it was put in because as I've been thinking on the budget, it's like we have to, they have, the sheriff's department needs two new cruisers this year. We can't, they go too many miles, in my estimation, to have.
It becomes an officer safety issue.
Right, I was gonna say,
It basically does.
exactly.
Where's the cover sheet? What's it look like?
That one. No, yeah, that one right there. Right.
I'm gonna write cover sheet.
Sorry, I'm giving you a lot of paper and a lot of numbers, but.
No, I just need to cover sheet.
And that will change as we go through and identify more areas where we can make changes, but
Nice.
that's the sheet I'm using to try to keep my head on straight.
So the things that are in there, were those are priorities, I mean, we went through those, how we did that, or,
No,
no, it wasn't, okay.
because the dryer, the dishwasher and the newer spreader were expensive things, so I pulled those out, and like the newer spreader should be a one-time thing. The dryer. The dishwasher, we obviously shouldn't have to replace for another 20 years,
Yeah.
15 years.
And we took the HVAC and refrigeration systems right out.
Yeah.
Right.
Because Craig has that in his one, in his two, and I thought if that's the lowest priority for Jim, let's just not do it.
Right.
Let's defer it. I don't mean not do it, but let's defer it for another year.
And the
Sorry.
press boards, if as needed, would just need to come out of the farm's operating budget.
Yeah, I think they're not a capital item, that I should have picked up on that.
Well, it does seem that someone ought to be able to make those. For some, well,
I will.
I don't- I have a lot of old minds. And I'm fine with this, I think. I made good
Yeah.
decisions.
Thank you very much.
So you also have, I gave you at the beginning-ish of our meeting, the cost for the new positions. The nurses are, I think I can hire contract nurses for the year for less money than what the jail budgeted for them.
That's a really high salary.
Yes. I think they must have budgeted for RN salaries. $118,000 per nurse.
So can we reconcile that number? Will they be working on that?
Yeah.
Okay,
Currently, the way I budget, the way other people, it isn't exactly the same.
well, do we need to go down through and just say what our expectations are?
Well, I think what would be helpful is, and I know this is a very, everybody is gonna have a different opinion about this, but if we could establish kind of what the consensus goal is of the Board of Commissioners, so I know what we're working towards to get to, that would be helpful.
Well,
I mean, there's just,
just in.
okay,
I was gonna say get to single digit to start. That would be a good start.
I mean, I think the challenge is this, going back and blanketly saying to everybody, you've got to cut money out of your budget. I've been through the commissioner's office budget, and the only area that I can cut is if you just don't want to do a 3-month overlap for my position.
How much was
Everything
that?
else is our cost of doing business, like,
Yeah, how
I,
much was the 3 month?
without going back and looking, I don't know, probably 30-something thousand maybe. That's literally ballparking it off the top of my head without going back and looking. But what I'm saying is like the smaller departments,
Right, yeah. Right, which is why we started. with
we're,
the big ones.
you know, we're
Right.
barely operating with what we need, so. To go back and blanketly say everybody's gonna cut their budget 5%, I don't think is the fair approach, because there's obviously some that. Are
Sure,
up considerably more than
Sure,
others,
that's
so. I have,
Well,
like I
and
said, I've been,
they can't personally, the salary and the costs, the personnel costs that are there. Kind of set, so that leaves them very few line items that we can actually.
I mean, I literally looked at the commissioner's office budget 4 times and said, where can I make any reductions? And. We could reduce the supply line by $500, but if we need paper, we need paper. Sam's doing her best to shop it, find the cheapest for us.
The only thing that I thought of, that I have been thinking of, is what you just said, the 3 month overlay. So I suppose, when all these changes are made and we get into the single digits, then we can look at that, but I do think that that might be a hard sell, to the delegation. And it's a little bit of a hard sell to me because, so the goal here is to, so we have an assistant county administrator, for 2 years now. And so I think that almost three, sorry, Molly. So to pay for an additional 3 month, to me might be a hard sell. That's the only thing that I can think that I might, unless, but
However, we do need to go through some sort of fair hiring process.
I think we need to post it.
Yeah,
It has to be posted.
yeah, so I
That's
think
our
we need to.
rules.
yeah, but ideally, I mean, for
There could be
instance,
savings, but whether,
so what I'm saying though is, we do need to post it, and so ideally, whoever steps into the position, just like last time we did this, whoever steps into the position should be prepared. I don't recall the last time that there was a different county administrator. I don't recall that Julie had a 3 month, right?
But I was here. I wasn't.
Yeah, I know.
Right. So the questions could be asked. I'm gonna go back to the Department of Corrections, if that's okay. I was just Googling average LPN salary in New Hampshire.
Yeah.
And I don't know if it's different within the jail, but I found a couple of different numbers, but it looks like, it's somewhere $35 to $40 an hour. So that gets to be, if we do the 39.34, which one of them said is 81.8, I don't know what the, just with salary, which, and then we're not counting any other benefits. So I don't know if that's different within the, correctional facilities, but it would be,
LPN line is the same for our LPN, we only have one LPN south of line, so it's the same for the nursing home as it is for the jail.
and what are our rates? That's what I was going to ask.
we don't have the details as to the number of.
It's amazing how much this has gone up, and I love it. I was thinking of that many years ago as a
Yeah,
nurse practitioner.
Right.
You retired too soon, huh?
No, I retired. I think it too.
Appreciate that.
The salary was not going to make a difference. And there's a fairly big spread, but I don't know how they figured that out. It's AI, so I don't know how, it's, I Googled it, so I know that these are.
Well, and if you compare them to the correctional officers, so. Around 70, but.
Looks like it ranges from 3107 to 4098.
Okay, that's about the numbers I came up. So that is significant, maybe a third less than the numbers that they put in.
But the RN line goes from 3792 to 5057, and I'm thinking that might be where they budgeted it, was it at an RN, because if they could find an RN, they would take one.
Well, maybe even changing it to one LPN and one RN, make it. Instead of two RN.
That's still, I mean, if we do 50-51, that still comes up, if I did the math right, it's only 105,000. And this, if we're looking,
Let me just let me pull up Jean's spreadsheet, because that'll be more helpful to me. Trying to.
and I certainly understand trying to budget for an RN with what they're going through.
Everybody's worst nightmare right now. You see an email from me, and they're like, oh God, what does she want now? Oh yeah, will you stop sending memos? All right, additional positions. They are budgeted at 5057.
Oh, is there a shift differential?
OT. I'm sure there are.
Yeah, so that would make a difference, because that would be for the base pay, and they're looking for overnights, that would be the difference.
There's overtime and, shift differential.
So that's what it would.
Yeah, because it comes out to 108,372 salary, because it also includes the COLA.
Yeah.
Which would be
Yeah.
applied to those rates. So that's what their budgeted is at the max line for an RN. We could look at, could we do one LNA? One LNA.
And then one RN for that line.
I also. Well, I'll wait and see what the jail comes back with, but I think that. After my conversations with the superintendent, he's not expecting 4 new positions. I don't know that he's even expecting 3 new positions, so.
Yeah, I get that feeling.
I would like to see, I think it's timely that we're going to be at the jail for our meeting next week. Because then we can ask some more specific questions. And the officers who are working in the different areas of the jail answer any questions we have for them. But changing those positions does not get us near 2 million.
Not even close. So with the nursing home. I'm gonna go back through, and we have April's salary, April's payrolls are done now. Because we finished this last April payroll yesterday, so I'm gonna go back and annualize through April 30th. And see where my numbers come out with when I annualize through April 30th. And then look, compare the two and see where, where we come out. I think if we went through and did a salary schedule by position that's approved for funding, it's gonna come out to more because of, here's my other concern, so well, I guess we've already hired them. But we still have like estimating 14 vacancies in the LNA line. And if they're gonna continue to fill those, try to fill those positions, I mean, theoretically, the contract nursing should be going
They should
down,
go
or should
away,
be having
yeah.
money left, which is why I'm struggling so much with where we're at this
Yeah.
year.
Just so maybe it would be helpful to understand if you had to fully use temps for the evening and weekends, what would that cost be? I mean, because we keep hearing that that's what those temporary nurses are being used for, LNAs, is for our nights and weekends.
And I've been going through their timesheets when I sign the invoices, and I will say the majority are the weekend or the second or third shift, but there are some first shift hours that it appears that they work, but the majority are the off shifts as we request.
And I'm just curious what those total hours are and
Right.
relates.
So what I'm doing
Would you-
outside of, I'm going through mostly for curiosity of my own mind, but I'm going through every single contract nursing invoice that we have for this year. And I'm making a spreadsheet that shows all of the hours that we're having LPNs and LNAs work, so that I can come up with an FTE count of what we're having contract
Mhm.
nurses work.
Oh, it's helpful.
In comparison to like what our vacancy rates are, because we're continuing to use a lot of contract nursing, and if we're only six RNs LPN short,
We should be not
more
using
than,
that, right, and six.
right.
Yeah.
So that's a fun exercise I'm attempting to complete, so.
So do you know if there's any like, the right word isn't lapse, but lapse in hiring and what we budget for positions and what we end up. Yeah. With people coming and going. Is there any area where we have a big lapse of time that doesn't get filled and?
Well, I mean, that absolutely used to be the case with correctional officers. I can't remember the last time we were fully staffed with correctional officers for, I think we've been fully staffed 2 months now, and that just doesn't typically happen. So usually we have that gap where we have a position that's vacant for a while and, so. The nursing home is just the turnover and the fluctuations that we see in the nursing staff particularly, not so much the RNs and LPNs, because we've been ever since we got back to the level that we're at, it's been very, very steady.
Yeah.
Even back to last summer or the end of last fiscal year. I went back and I compared like what Karen's report said for vacancies like last July to what they are now, and they're almost identical. So, we're not seeing that fluctuation. The LNAs, I mean, it's an entry level job and the turnover is always gonna be.
Sure.
I know everywhere I've worked, whether it's the LNAs or whether like in an outpatient setting, it's a medical assistant.
Yeah.
They do change a lot, and there's, I think a lot of it is the grass is greener on the other side, because they they offer a few more cents, you get a hiring bonus, and so you work through the amount of time, you get a hiring bonus, and then you go to someplace else for the next bonus. But looking at their pay, I could see why someone would do that.
Also kind of a changeable time of life for most of them, the young ones.
And I will say a lot of times the really good ones go back to school,
Right.
and then they
Yeah.
then they end up in an RN program or something like that.
Yeah.
I mean, we'll all go back super thoroughly, and go through everything and work with Craig and Dawn to try to come up with something more than better than what we've got. And still being realistic, so we're not,
Right.
you know, cutting our nose off to spite our face next
Because
year.
right, I was gonna say, we'll be sitting here next year trying to
Do the same.
do it in the worst position.
And I don't know if it's, this isn't gonna help this year's budget. But if we're looking to the future, perhaps over the next few months after we get whatever budget through, they can start switching their budget, so next year when it's looked at would be per position and not annual. Because I think, as you said, it goes up and down, and I did find that their explanations were quite wishy-washy. And it was hard to get, it was just hard to get a good answer on how they're looking forward to this. Because, you know, obviously, as we just had the conversation, so I'm probably beating a dead horse, but, you know, if we're filling up these positions and we're doing, and, you know, it looks like we are, that the numbers had not gone down. And I will say, I did ask a couple months ago, because as I sign invoices, I've been signing the medical solutions, I get the same ones, I look at the names, I know who's new, who's old. And I had not gotten, the factor, is that what it's called, the factor for all, that, for a long time, and I did ask, are we down to only one agency? And the answer was, oh, they're sometimes delayed in getting us their invoices, and then we got the ones for many months. And they have all of the nurses and LNAs on one page as the medical solutions. We have a packet per employee there.
Them all down, pages and pages.
I see that. You know, I will say that those are the kinds of things I do, and I had not, especially because I thought they were decreasing until I got the whole stack. I know you had done
Well, I
that.
thought we were in really good shape.
Yeah.
Going in with the contract nursing, and when I was on vacation, and when I got back at the check run, all it was like, we got all these Factor healthcare invoices that a couple of them go back to last fiscal year, and I'm like,
Right. And I know, Commissioner McLeod, that you had said when you were clerk and signing the invoices, you had done a similar thing at one point, and as I looked at them, I checked that look what ships and stuff, but I haven't been writing it down, because again, I thought we were getting fewer invoices in.
and that's my problem with that too, is somebody over there knew we were using all these nurses for LNAs.
Why weren't they asking?
Why weren't they asking for,
Right.
where are the invoices?
Yeah.
Because when I asked that, they said they didn't have any idea they were missing the invoices. Well, you gotta know that these people are working and we're not
Right.
paying for it.
Which is interesting, because like I said, I do remember within the last couple of months asking when we had our monthly meeting of, are we only using one agency? Or are we primarily using one agency? And I did get the answer, no, we're using two, but I didn't.
We also seem to be using a lot more from Factor than we are currently. And Factor's both LNA and LPN rates are cheaper than Med Solutions, only by $3, but we do seem to be using a lot more employees from Factor than we are from Med Solutions right now.
And we are paying so much more through an agency than we could be
Oh, yeah.
if we ended up getting it fully. And I know in the North Country in general in healthcare, many positions on every level are done by travelers. So I'm not faulting that, it's just how we're coming in.
Well, if we do kind of wonder though, if we have that available and those folks available, are we not trying to fill those positions locally at those times, because they're a little more challenging?
I mean, I think we're always trying to fill the nursing positions. They're not being at, I think we're at 6 vacancies, and That's the lowest we've been
Yeah.
in years.
Yes, those particular times.
Oh, the
weekends
evening and.
And weekends and is nice, yeah.
And then I guess my other question, and I haven't ever asked this before, so someone may have an answer, is, are we not asking our employee nurses to do overtime and just going directly to the, contract nurses? Because,
That's kind of my, was one of my questions.
And and if you look, like. These contract nurses and LNAs are working 62, 57,
Well, there's a
61,
lot of
48,
overtime.
58,
Wow.
62, 55, 57, 90, 80 in a week.
right,
Oh.
So it looks like a majority of the overtime is going to travelers,
right. Which we should try and have,
which we have a full per diem slate of at least LNAs, so.
which should be filling in
Well,
most
are
of
we
those
not
overtime.
offering enough of an incentive for nights and weekends to our current staff themselves? For them to be wanting to do that work?
But I can't answer that.
Or is it easier to not ask someone to do overtime? Whereas if you have contract people who will just do it. You know, you know, I know when I had done shift work as nursing, you did not, you know. We had to cover our own, so you had to do it and you didn't want to do a mandatory overtime type thing, but there were different incentives
Yeah,
and different
right.
ways to do it without making someone stay on a shift that they needed to leave. You know, which I also had a job that did that, like, oh, well, it's your turn, so you're staying for a double shift, even if you had someplace, you know, that you couldn't stay.
It does impact whether people stay in the job or not. But the amount, I'm just wondering, we had that.
No, that's what that was my question is, how is it?
Yeah.
And if someone's only looking at this as a, I don't know how long they can stay at one contracted place, but if you're gonna, and then rack up as much,
For a long time.
Yeah, the names of the.
yeah,
They've been there.
They're renewing, their 13-week contracts are just getting
Yeah.
renewed and renewed.
because there are certain places that also limit the number of times you can sign up for a contract.
Right.
Right. I didn't recognize one of the contract names we've now hired as our own nurse, so.
Oh, that's nice.
Good.
But if we're paying so much overtime at the contract rates, that's one of the reasons why our contract numbers are so huge.
Yeah, the rate doesn't change. We pay the same rate, whether it's overtime or straight time.
Okay.
I'm sure that's not how it works for the employee. They, obviously have to be over. The rate must be high enough to absorb that. We're paying $58 an hour for Med Solutions for an LNA. We're paying $75 an hour for LPNs. And in fact, we're paying 55 and 73. We just talked about what is an LPN, $40 an hour is their normal, we're paying 70. So I definitely picks their overtime at a time and a half, so. So here's, I guess, my suggestion is. I asked everybody yesterday, I sent out an email yesterday and I said, now that we have 9-month numbers, can everybody please just take a look at their budgets again? Revenue, expenses. Said the commissioners meet tomorrow. I'm likely going to be back in touch with you with some more specific directives of how to, of what to do, so. Not like everybody should already be on notice that
Yeah.
we're gonna be looking for some reductions, so. I just need to think about what's the best way to approach that in fairness and,
Now, I guess my other question, is, as the county, do we have vacant positions that we can decide not to fill and eliminate those positions in any of the departments? I know we tend to run on a fairly tight budget, so yeah, I don't, like,
Well, and since COVID, we've been trying to get people back to, get things back to where
they were.
we covered, yeah.
You know, and I think that we don't have vacant positions that we aren't trying to hire for. I mean, we would like to fill those vacancies. They're not just vacant positions that are sitting there like that. We aren't trying.
That are what we can do without. So we don't have any that we, if we look at, that we could just do without.
Certainly a question I can ask, but my guess is
The
the answer
answer
is
is
likely
no.
going to be no.
I'm just trying to think of other ways to find some dollars.
Well, absolutely, because clearly our personnel is our biggest
That's
dollar.
right.
Well, the other thing about the budget is that so much of some of these smaller departments, their increases are not their fault, right?
Right.
It's not that they're
Right, right.
asking for anything else, they're
100%, it's
cost
Cost of-
increase, healthcare, maintenance, utilities and.
And the utilities, we have to face is how huge the utility increases are in all of the budgets. That we don't have anything, so for us to make up the cost of the utility. If we wanted to zero that out, we'd have to make a fairly substantial cut in someone's budget.
So schedule wise, what do we?
So I guess we're meeting next week.
We're meeting next week, and it's probably a good chance we better
Possibly
get one scheduled for the week after that.
Yeah.
So,
I don't think we had the 30th down.
We were the, if needed, it was, and if needed.
it's definitely needed. As you heard me say, we really need to shoot for May 8th as our target date to be done no later than that.
Because the executive committee meets on the 11th.
Yes, but that's not why.
Right, but there-
We have statutory guidelines that sort of govern dates, so
Yeah.
when stuff has to be gapped, like there has to be 28 days between when your budget gets mailed out and the delegation can vote on it. We have the delegation meeting set for June 22nd, so.
We have to.
And then you gotta do the public hearing, and so.
Yep. Got it.
That little math on my, one of these paper, where I did all the math of.
So we're meeting next week. And then did you say we're also meeting?
I'm saying there's the potential that in the week of May 4th, we're gonna need to figure out another day that we,
Okay.
either we make your commissioners meeting on Tuesday, a budget meeting, I don't know. It depends on where we get next week, but it seems like to finalize things, we'll need
Yeah.
at least 2 more meetings.
So the 28th and the 30th.
For
Yeah,
that,
yeah. And then when we get done with the 30th meeting, we can figure out where we're at and if we need another meeting. I likely wouldn't push it out to Thursday. I'd like rather meet earlier in the week.
Mhm.
Guess I can use, I don't know, longer day on Tuesday and take care of whatever commissioners should do that. And
Tuesday, are you talking about the 5th?
yeah,
Okay, because I was gonna say could we potentially move next week's to Wednesday? I did not have it, well, doesn't really matter. I'll just be here all day,
it doesn't make any, I'm available on, let's say, until 1 o'clock. Doctor's appointment, I'll have to.
One of the reasons to do it on the 30th is there was
It's an event that you could attend.
that there was an event that I was invited to in North Haverhill.
as a retirement.
Yeah.
No. It's not. Oh, Really? You were invited to an event here.
I was invited to an event as a commissioner, but it was up here.
Okay.
It doesn't mean I couldn't come up 2 days or 3 days in a row. It's just a lot of driving.
Yeah. Or we could stay later on Tuesday and do more. Okay, well, here we are.
So what do we want to do next week? It'd be good to get it on the calendar now. At least for me.
So the 30th, we're possibly moving that. I mean, I think, is that what you're saying?
I'm just saying, because Martha wasn't, no, I had it, I had the if needed meeting in my calendar.
Okay,
Um,
yeah, but Martha wanted.
but she didn't know about, whether she asked if we could do it on Wednesday.
I'd rather. I don't know if I have all my appointments in, possibly we could.
Or just stay late on Tuesday, the 28th. Oh, we've got we have a building committee meeting at 1 that day.
I don't think we can.
We're at the jail and then we have the building committee, we were scheduling that day also, right?
Bonus with leaving it on Thursdays, it gives us more time. That's
Yeah.
like
Yes. Well.
What else we need to do? Otherwise, we should do public comment. Such? I think if we've done our business, no commissioners issues to talk about. Okay, all right, is there, Mr. Guerrero has his hand raised for the public comment.
I can do the timer. My calculator won't work for that, but I got it now.
Can you hear me?
Yes.
Quick suggestion. Since we're trying to reduce, the budget and also help all departments, I'm wondering, since I cannot ask a question, and I see the sheriff is on, is it possible for the commissioners to ask the sheriff if she could self-fund her cruiser under the Seizure and Forfeiture Act, that is supposedly a law, and maybe get a capital reserve fund going by which her department could save money and help reduce drugs on our highways and throughout New Hampshire. It was pointed out at one of your meetings a few weeks ago that there are drug dealings going on at the trailheads. So maybe if the sheriff's department and other police departments could help us out by self-funding their own cruises, by capturing these drug dealers and confiscating their vehicles, selling them at auction or whatever. I don't know what hurdles would be involved, but maybe you could ask that question and maybe we could get her 3 cruises instead of 2. Thank you.
Thank you. Thank you. I think that's something that we done offline. Do that online. Is there anyone else that's got a public comment? Hearing none. I'll move to adjourn.
Second.
Hey, all in favor?
Aye.